So our next topic is urinary tract infections in children. So how urinary tract infection are presented? The presentation of urinary tract infection is fever, abdominal pain, loin pain, dysuria, and increased frequency. So dysuria, frequency, increased frequency, and fever. These are some presenting features of urinary tract infection in children. The risk factor for urinary tract infection is stasis of urine, such as in renal caliculi, vesico-ureteric reflex, and phimosis, constipation, sexual abuse, and previous history of UTI. They are all risk factor uh, for urinary tract infection in children. Now, investigation if we are suspecting a UTI is urine culture and sensitivity. Initial testing will include dipstick urine testing to see nitrites and leukocytes in the urine. And if it's positive, then we'll need to send a urine culture and sensitivity by a clean catch urine sample. And if clean catch urine sample is not possible to obtain, then we can use a catheter sample or a suprapubic aspiration. And the treatment would be nitrofurantoin 100 milligram BD or trimethoprim 200 milligram BD. Now, UTI is an important topic in pediatrics for Plab 1. And the question that is usually asked in this topic is about the radiological schedule according to NICE guidelines in different age groups. So remember that there are 3 tests are usually done in case of UTI in children. One of them is ultrasound, second one is DMSA scan, and third one is MCUG, micturating cystourethrogram. So these 3 radiological procedures or tests are done in children with UTIs. So when they need to be done, it's very important to remember that. So the first point that you need to remember is that this schedule is different for different age group of children. So the first thing that you need to remember that MCUG is only indicated by the NICE guidelines in children who are less than 6 months of age. MCUG will not be done in children who are above 6 months of age. NICE guidelines does not recommend MCUG in children who are above 6 months of age. So in the children who are above 6 months of age, we will only do 2 tests. One of them is ultrasound, and the second one is DMSA scan. Now the duration of time during which ultrasound needed to be done, immediate ultrasound or ultrasound within 4 to 6 weeks, that we need to decide that when to go for an immediate ultrasound and when to go for a ultrasound within 6 weeks. And remember that DMSA scan will always be done 4 to 6 months following infection. DMSA scan will always be done 4 to 6 months following an infection. While ultrasound can be done immediately or it can be done within 6 weeks of infection. So now let's do it.
I have a question.
So urinary tract, yes.
Sorry. Why is it that the MCUG is only for children under 6 months?
Is an procedure, plus there is radiological exposure, and plus if someone has a congenital anomaly of the ureter, that is abnormal implantation of the ureter, it can be diagnosed within 6 months of age period. So that's why NICE does not recommend this MCUG in children who are above 6 months of age. There are 2 reasons for that. because in above 6 months of age, vesico-ureteric reflex due to this abnormal implantation of the ureter is very less common. If it's present, it could be diagnosed before 6 months of age. So that's why unnecessary exposure to the radiations uh, and more harm than good to the children who are above 6 months of age. The NICE does not recommend this MCUG in older children.
Oh, okay. Got it. Thank you.
So there are some indication in children who are above 6 months, MCUG can be performed. In children who are above 6 months, if there is poor urine flow, family history of VUR, and non-E. coli infection. So if the suspicion of is vesico-ureteric reflex is very high, that is dilatation of the ureter on ultrasound, poor urine flow, or family history of VUR or non-E. coli infection, then it can be done in children who are above 6 months, because then it would be more beneficial to diagnose this vesico-ureteric reflex disease so that it can be managed. So this is the only indication in of MCUG in children above 6 months of age. That is high suspicion of vesico-ureteric reflex. So now the imaging schedule for infants who are less than 6 months of age. Now there are three types of UTIs. One is straightforward UTI, one is atypical UTI, and third one is recurrent UTIs. So what is a straightforward UTI? A UTI that responds to treatment in 48 hours is a straightforward UTI. And atypical UTI is which has an atypical presentation, such as abdominal pain and toxic child, poor urine flow, etc. And recurrent UTI is two or more UTIs in the previous 6 months, or three or more UTIs in the previous 12 months. If the child has such kind of history, then we'll label it as recurrent UTI. So if the UTI is straightforward and the child age is less than 6 months, because it's a straightforward UTI, so immediate ultrasound is not required. Ultrasound will be done within 6 weeks after infection in case of straightforward UTI, and DAMSA and MCUG will not be done. While for atypical and recurrent UTIs, immediate ultrasound will be done, and DAMSA scan will be done 4 to 6 months following the infection to see if there is any renal scarring, and MCUG will be done. It will also be done. So all the three tests need to be done in children who are less than 6 months of age if they have atypical UTI or recurrent UTI. Immediate ultrasound and DAMSA scan and MCUG. Now, imaging schedule for children. Imaging schedule for infants and children who are 6 months and older, but younger than 3 years. So imaging schedule for children who are between the age of 6 months to 3 years. Straight, if the UTI is straightforward, that is if respond to treatment within 48 hours in the children who are 6 months to 3 years old, then no imaging is required. No immediate ultrasound, no ultrasound within 6 weeks, no DAMSA scan, and no MCUG. it is not required. Now, what will we do if there is atypical UTI? So we have already discussed that MCUG will not be done in children who are above 6 months of age. So we are only left with two investigations, two imagings, that is ultrasound and that is a DMSA scan. So in case of atypical UTI, ultrasound will be done immediately and DMSA scan 4 to 6 months following the acute infection. But in case of recurrent UTI, immediate ultrasound is not indicated. It will be done within 6 weeks of the infection and MC or DMSA scan at 6 months of the age. So you can see that the difference in below 6 months children and above 6 months and below or younger than 3 years is that in atypical UTI and in recurrent UTI, in both of them, immediate ultrasound will be done. While in children who are older than 6 months, in atypical UTI, immediate ultrasound will be done, and in recurrent UTI, ultrasound will be done within 6 weeks. And DMSA scan will be done at its time, that is 4 to 6 months after the acute infection. Now, for the children who are older than 3 years, for recurrent UTIs, the schedule is same. For recurrent UTIs, the schedule is same. That is ultrasound within 6 weeks and DMSA within 4 to 6 months. That is same for children who are older than 6 months and older than 3 years. While for atypical UTI, the schedule of ultrasound is same. That is, imaging will be done, ultrasound will be done immediately in children who are 6 months old, 6 months or older, and in children who are 3 years or older. In case of atypical UTI, ultrasound will be done immediately, and there is no need to do a DMSA scan in case of atypical UTI if the child is 3 years and older. So this was all about the imaging schedule of UTIs in children. Very simple. First of all, straightforward UTI. Straightforward UTI, ultrasound is done within 6 weeks if the child is younger than 6 months. All other age categories does not require any imaging if the UTI is straightforward. Now, atypical and recurrent UTIs in children who are younger than 6 months, and immediate ultrasound, a DMSA scan, and MCUG, all three will be done. And in children who are 6 months and older and 3 months and older, 3 years and older, no MCUG will be done. We only do two investigations, that is ultrasound and DMSA scan. So in case of atypical UTI, ultrasound will be done immediately, no matter whatever the age group is. In children who are older than 6 months and in children who are older than 3 years, in case of atypical UTI, immediate ultrasound will be done and the DMSA will be done at its time, that is 4 to 6 months, and it is not done in children who are 3 years and older. And for recurrent UTIs, schedule is same in children who are 6 months and older and 3 years or older, that is ultrasound within 6 weeks and DMSA scan within 4 to 6 months of following an acute infection. So I hope it's somewhat clear, the schedule to everyone.
So what type of question can we get regarding this imaging? Will they give us?
Let's discuss an example. Let's discuss
Yeah,
an
because that's
example,
quite
then you will see what kind of questions you will get. So example one is a 6-year-old girl had dysuria and was treated with antibiotics. The urine culture was positive for coliform bacteria. This was her first time getting a UTI. Her symptom had disappeared 2 days after initiating antibiotics. What should be done? Age group, and the diagnosis is here is straightforward UTI because she has responded to the treatments, and this is the first time she is getting the UTI. So the diagnosis, straightforward UTI in children who are above 6 months